Benign prostatic hyperplasia, BPH, develops in man and dogs, but not in other species. Approximately 40% of intact male dogs develop prostatic hyperplasia by 2.5 years of age, 80% by 6 years of age, and 95% by 9 years of age. The Sharpei in this video was showing prostatic hyperplasia at 9 months of age. With benign prostatic hyperplasia, the prostate will be greater than 1.5 centimeters in width. The parenchyma will be homogeneous and hyperechoic. In man, hyperplasia initially grows inward toward the urethra and can cause urinary obstruction. In dogs, because hyperplasia grows outward away from the urethra, urinary obstruction is rare. Mineralizations can develop in the prostate of intact dogs with benign prostatic hyperplasia, but only about 22% of these cases have prostatic neoplasia. When intact male dogs with benign prostatic hyperplasia are neutered, the prostate decreases in size but remains larger than 1.5 centimeters in width. There should be a palpable decrease in size 2 weeks after neutering, and a 75% decrease in size 2 months after neutering. The parenchyma will become hypoechoic and homogeneous. The excessive size and homogeneous hypoechoic parenchyma indicates that the dog was neutered later in life and not at 6 months of age or earlier. Dogs with benign prostatic hyperplasia and prostatitis will show localized hypoechoic areas within the hyperechoic and enlarged prostate. The prostate may also have a mottled or moth-eaten appearance. With chronic bacterial prostatitis, long-term antibiotics and castration are recommended. Note the acoustic shadow from the pubic bone on the right side. Any male dog with a urinary tract infection should be considered to have a prostate infection as well. Conversely, because prostatic fluid normally refluxes into the urinary bladder, urinary tract infection is usually present in dogs with prostatitis. Cysts appear as localized anechoic lesions within the prostatic parenchyma. A cyst can have a smooth, regular outer edge or be irregular in shape. Cyst size should be measured for comparison in serial ultrasound exams. Retention cyst may result from duct blockage and fill with prostatic fluid. Prostatic cysts often result from or indicate the presence of infection in the prostate and will be filled with pus. In one study, 42% of prostatic cysts in dogs with no clinical signs of fever, anorexia, or lethargy were infected. Cysts of the prostate should be aspirated and cultured for bacterial growth. This video is from an 11-year-old intact male dachshund, initially presented for blood dripping from the penis, fever, and anorexia. Within 2 days, he would not even walk. White blood cell count was 25,800, primarily neutrophils. Ultrasound suggested multiple cysts of the prostate as the cause of symptoms. After sedation, approximately 50 cc's of pus was aspirated from 3 main cysts of the prostate. This 26-pound dachshund was walking again when he recovered from sedation. Long-term antibiotics were given. Prostatic hyperplasia does not occur in the neutered dog. The most common cause of prostatic disease in the neutered dog is neoplasia. Prostatic neoplasia typically affects dogs older than 10 years of age. Prostatic adenocarcinoma is the most common neoplasia, but undifferentiated carcinoma, squamous cell carcinoma, transitional cell carcinoma, lymphoma, and hemangiosarcoma are also possible. This video is from a 12-year-old neutered lab. Note the multiple small mineralizations and cysts in the prostate. Prostatic neoplasia originates from prostatic basal cell lines and is not androgen-mediated in dogs. Prostate tumors are locally invasive, highly metastatic, and have a poor prognosis. Approximately 70 to 80% have metastasized by the time of diagnosis. This video is from an 8-year-old neutered schnauzer presented for lethargy, tenesmus, and thin, ribbon-like bowel movements. On ultrasound, prostatic neoplasia is usually enlarged and irregular in shape. Tumors often contain a variable number of mineralizations with or without acoustic shadowing. In one university study, 100% of neutered dogs with prostatic mineralizations had neoplasia, while only 22% of intact males with prostatic hyperplasia and mineralizations had neoplasia. The owner of this 14-year-old neutered lab declined treatment for prostate neoplasia when the dog was 11 years old. This video was a recheck ultrasound 3 years later. Note the large, irregular size and presence of a cyst and mineralizations. Cysts and secondary bacterial infection of prostatic neoplasia are common. Prostatic neoplasia is usually surrounded by hyperechoic fat, suggesting inflammation. Biopsy is necessary to identify the type of neoplasia. Prostatic tumors can extend into the bladder, and bladder tumors can extend into the prostate. Enlargement of regional lymph nodes is a poor prognostic indicator. Transitional cell carcinoma extends from the bladder into the prostate in this 11-year-old neutered Sheltie. In most cases, normal lymph nodes within the abdomen or thorax are not seen on ultrasound unless they are enlarged. An entire chain of lymph nodes is located along the major blood vessels dorsal to the urinary bladder and ventral to the lumbar vertebrae. The lymph nodes cranial to the aortic trifurcation are known as lumbar aortic or sublumbar lymph nodes. This 10-year-old Coton was presented for anorexia and lethargy. The sublumbar lymph node was enlarged. The diagnosis was multicentric lymphoma affecting the liver and abdominal lymph nodes. When enlarged, lumbar aortic lymph nodes are usually seen in a ventral midline sagittal or transverse view. They may be seen dorsal to the bladder and between the bladder and blood vessels. This video shows an enlarged lumbar aortic lymph node in a 10-year-old Weimaraner with prostatic neoplasia. Enlargement of the lumbar aortic lymph nodes is a poor prognostic indicator, when ultrasound lesions of the bladder or prostate are present. They are usually associated with chronic infection or neoplasia. Lymph node diameter of 2 centimeters or greater almost certainly indicates neoplasia. These lymph nodes are not specific to the urinary tract, but drain the rear quarters of the body. This video is from an 8-year-old pit bull presented with hematuria and stranguria due to prostatic neoplasia. It is easiest to find the medial iliac lymph nodes from a lateral sagittal view with the transducer placed at the patient's left flank. Slide the transducer dorsally to look under the lumbar vertebrae. Find the caudal aorta and follow it caudally to the aortic trifurcation. The medial iliac lymph nodes are lateral to the aortic trifurcation. The lymph nodes will not be seen in every patient. Color flow Doppler is very helpful in locating blood vessels and lymph nodes. Enlargement of the medial iliac lymph nodes is a poor prognostic indicator when ultrasound lesions of the bladder or prostate are present. These lymph nodes are not specific to the urinary tract, but drain the rear quarters of the body. The medial iliac lymph node may also be seen from a ventral midline transverse view to the left lateral side at the aortic trifurcation. The hypogastric lymph nodes are located medial to the aortic trifurcation. They are best seen from a left lateral sagittal view with the transducer placed at the patient's flank. Enlargement of the hypogastric lymph nodes is a poor prognostic indicator when ultrasound lesions of the bladder or prostate are present. These lymph nodes are not specific to the urinary tract, but drain the rear quarters of the body.